evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will return to the subject of psychiatry, as one of our area's leading specialists shows us a new brain scanning technique that helps psychiatrists diagnose mental diseases. Our returning guest this evening is Dr. Herbert Schiro, who offers psychiatric services for adults and children in his Yuba City office. It's hard to imagine a scan that can non-invasively look into the brain and use this information to find evidence of mental diseases. Well, tonight, Dr. Schiro will show actual examples of the new Spect Scan. In our pharmacy corner this evening, our award-winning neighborhood pharmacist Bob Church will discuss the controversial area of reuse of syringes and needles in the care of people with diabetes. We all know that the sharing of needles between individuals is an extremely dangerous and forbidden practice. But what about one particular person wishing to reuse their own needles or syringes as they give themselves their daily insulin injections? This is an interesting current issue, and I look forward to learning more about it in tonight's Pharmacy Corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. Look out, LASIK. There's a new surgical breakthrough that may soon let bleary-eyed baby boomers read the fine print without squinting or probing for their glasses. The painless 45-minute implant operation called surgical reversal of presbyopia, or SRP, is the focus of a new Food and Drug Administration monitored clinical trial. If the trial is a success, the surgery could be available to patients in the United States as early as 2004, when the youngest baby boomers hit age 40. That's the age when presbyopia, which can't be cured through LASIK or laser surgery, begins forcing most people to hold things at arm's length to see them clearly. It's a sign of age, and it's inevitable. By age 45, nearly 9 out of 10 adults need corrective lenses for reading or close-up tasks, such as sewing. The new SRP procedure offers a revolutionary alternative to glasses that turns traditional thinking about the vision problem upside down, its supporters say. Doctors have been taught since the mid-1800s that presbyopia was caused by a progressive hardening of the lens as people age. A new theory is that presbyopia occurs because the lens, like fingernails or hair, grows throughout a person's life, eventually crowding and hampering the muscles that control it. In the operation, doctors insert 4 tiny implants into the pockets created in the sclera, or the white part of a patient's eye. The implants stretch the sclera over the muscle that pulls the lens to adjust focusing. With more room to work, the muscle exerts a more powerful pull, allowing the eye to focus once again at close range on small objects like words on a page. The surgery is performed under topical or general anesthesia and will probably cost between $5,000 and $6,000. These new implants, made of the same material used in cataract surgery, can be removed if problems develop. Best of all, doctors say the procedure is done on the part of the eye rarely associated with surgical complications. Besides dry eyes, patients also may experience temporary redness, tearing, or sensitivity to light after the new procedure. Eye specialists hope the FDA trial will answer lingering questions about SRP procedure. One prominent ophthalmologist says it's not clear how the implants work to reverse the effects of presbyopia. Remember, presbyopia is an unavoidable consequence of aging. A 10-year-old can see a small object 2 inches from his eyes, while a 30-year-old would have to hold it 6 inches away. By age 45, he'd have to hold it 12 to 16 inches away. If you're interested in new treatments for the condition of presbyopia, you should check with your favorite eye care professional. Eating fish, even in small, modest amounts, can significantly reduce a woman's risk of the most common type of stroke, a major new study suggests. The study of nearly 80,000 women found that eating fish was linked to reductions in the risk of ischemic or clot-related strokes, which account for about 83% of all strokes. Women who ate about 4 ounces of fish 2 to 4 times weekly cut their risk of ischemic stroke by almost 50%. Slightly higher risk reductions were found in women who ate fish 5 or more times weekly, but there were relatively few women in that group. Slight risk reductions were also found even in those who ate fish just once a week or less. Omega-3 fatty acids found in most fish have been shown to lower levels of blood fats linked to cardiovascular disease and to help to keep blood from clotting. The fats are especially plentiful in dark, oily fish, such as mackerel, salmon, and sardines. The findings appeared in a recent issue of the Journal of the American Medical Association. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the pharmacy corner is our award-winning registered pharmacist, Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
Year after year, we're here together, and we look as young as we did 15, 17 years ago, right?
There's no doubt about that.
I do want to mention, though, if they see you riding in the Harley-Davidson down the street, that is Bob Church over there, you know, on the
Absolutely, just a little different gear, a little different uniform.
One of these days I want your wife, who's also a pharmacist, Karen, to get me a picture of you, and we're going to secretly edit it into this show so everybody can see what you look like on there. Is there really a controversy over the reuse of syringes? I mean, that seems like such an unusual idea.
Well, to me it's an unusual idea, but you have to realize when there's a controversy, there's different points of view. And there certainly is with this one. You have to realize that when people are using diabetic supplies and syringes and needles every day, it becomes an issue of convenience, of expense, whether they have insurance coverage or not. I mean, some people are expending up to $3 a day just to do their testing that they need to do to control their blood sugar. The other side to that is a safety issue, a cleanliness issue, hygiene. As we know, people who have diabetes are more prone to infection. They don't handle infection as well as other people do. So there's two sides to this issue, and both are valid sides, I think.
Tell me about the history of all this idea.
Well, before we had disposable syringes, people did reuse their needles, their syringes, but they boiled them first, which, if done adequately, sort of ensured their sterility, and there wasn't a problem. With the advent of the disposable syringe, nicely packaged, little cap on top of the needle, with no warnings as to cleanliness, safety, etc., people found that it was a way to decrease their costs by reusing those syringes. And I think probably, I mean, rightfully so, there wasn't anything there to tell them not to do that. So it was a personal decision.
What's the feeling of the big groups like the Diabetes Association and medical groups and things
well,
about that?
Interestingly enough, the Diabetes Association sort of goes along with the idea of reusing syringes if certain criteria are met, such as recapping the needle as soon as the injection is done, no evidence of acute illness, no open wounds, personal hygiene is good. If you don't have an immune system that's compromised, let's say by other drugs or for whatever reason, they're saying, and I'm not sure it's an actual policy on their part, but their attitude is that that's what they're going along with.
What about the manufacturers? What do they think about that?
Well, obviously, if you think about manufacturers, you know, obviously they have a position where they want to sell syringes, so you would expect them to be against it. But I think it goes deeper than that. They are now involved in a campaign where they're inserting pamphlets into the boxes of syringes to remind people that they are designed for one-time use. And I think the issue is cleanliness, and it's also because of the way the syringes are manufactured now.
As a pharmacist yourself who deals with people every day using these things, what do you think problems could come up with this?
All right, my attitude is that I don't like the reuse of syringes, basically for two reasons. The syringe needles now are much, much thinner than they were before. they're much more fragile than they were before. The bore or the opening in the needle is still the same, which means that to make the needle thinner, the walls of the needle itself have to be thinner. So they bend easier. Even after one injection, the tip of the needle can become damaged, and that in itself is a means for infection. People are storing syringes preloaded with insulin, and they're putting them in the refrigerator. That causes an expansion or a decrease in the volume sometimes of the insulin in the syringe. They're doing that with the auto-injectors that have the pins attached, the pin and the needle attached to it. And so when you get fluctuations of volume, you don't get the right dose of the insulin. I see people who I don't think have the best personal hygiene, and they're doing this, and I think that's a lead-in to infection. So my personal feeling is I don't think it's a good idea.
You know, when I use a needle on a patient, obviously it's one needle and you throw it away.
Certainly.
But sometimes with the same patient, you might have to inject a couple of times, like local anesthetic. You might have to hit it a few times with the same needle. I even noticed just doing that on the same patient, the needle gets dull after one or two touches, and you have to change it. So imagine for them trying to do the shots at home, they're going to start poking these needles in and getting bits of skin on them and other things that could get infected. So I would be very leery about that. So, gee. If one did choose, though, to not take our advice and they decided to do that, do you have any basic safety measures they should keep in mind?
Yes, I think number one, the decision to do this has to be the person's decision, not a caregiver's decision or somebody else's decision. If they choose to reuse those syringes, they need to recap that needle as soon as the injection's done. They should only reuse the needle for 1 day's worth of injections and discard it after 1 day. They have to make sure that their personal hygiene is good, that they don't have any source of infection at the current time, that they don't have any open wounds. Do not wipe the needle with alcohol. That destroys the silicone coating on it, which allows that needle to go into the skin very readily and very easily.
Interesting.
And when that needle point becomes dull, you need to get rid of it, even after a second injection. If you feel that that syringe isn't as sharp as it was the first time, then don't use it again.
I guess I don't even have a good concept of what people spend on these things. Do you have an idea that you might be able to share with us?
I think normally a box of syringes is in the neighborhood of about $19 for a box of 100.
Oh.
But then you have the expense of the strips, the alcohol pads, all of the supplies that go with their machine, which they're using to read their strips, the Lancets, the Lancet device. The expense on a daily basis can get up there, and it's a concern for people.
Well, this is a very interesting topic, and I'm really glad that you came over to share it with us on the Medical Explorer.
Thank you.
We look forward to you coming back on future Medical Explorer programs as usual, and thank you very much.
You bet.
Right. Now, on with the Medical Explorer. I'm pleased to bring back to our Medical Explorer studio one of our area's most highly trained specialists in the field of diagnosis and treatment of diseases that affect the brain, personality, and behavior. Let's welcome back psychiatrist Dr. C. Herbert Schiro. Dr. Schiro, let's begin by having you review your background and current work in Yuba City. Tell me a little about it.
Well, I'm now in full-time private practice here in Yuba City. I've worked in a variety of positions in the area. One of the most interesting, and the one that I'll be using information about today, is at the Amen Clinic in Fairfield, where Spect scanning of the brain has given us pictures of brain function. Psychiatry has been the only area where we have no idea what's really going on in the organ that we treat. And Spect scanning is changing that.
Well, we'll get into that, of course, in detail, but I'd also like you to maybe review some of the daily things you do in psychiatry, just so our viewers have a good feeling for your areas. Do you mind just doing that, please?
Well, surely. I see children and adults, and I'm now in full-time private practice in Yuba City and Chico. I've been a consultant for the California Correctional System, for Sutter North, for several foster care agencies. and for the county at one time or another.
What are the most common actual medical conditions that you treat?
In adults, depression, substance abuse, and the anxiety disorders. In children, attention deficit disorder, depression, and impulse control disorders.
Interesting.
Yes.
Now I guess we should now get into the scanning idea, because I've seen little images of this on television news stories, and it's sort of fascinating. How we've actually shown on the Medical Explorer program CAT scans and MR scans of the brain, which basically shows the anatomy in one position. How is scanning used in your field? How will that work?
Well, SPECT scanning stands for Single Proton Emission Computerized Tomography, so you can see why people rarely use that name. It is a picture not of brain anatomy, but of brain function. And the way it works is that a short-acting radioisotope is injected, and there is a four-headed camera which moves around the brain in 12 to 14 minutes. And with the use of a supercomputer, the images are produce a three-dimensional picture of the areas of greatest and least brain activity.
Now I see you're going to show us now an actual normal scan which has interesting colors. What do the colors represent on these scans?
Well, the colors are added by the computer, primarily for the convenience of the viewer.